morning. This is Dr. From Fortis VADAPALANI. Today we are going to learn about BLS. BLS means Basic Life Support. So today I am going to teach you BLS in 5 to 6 simple steps. So consider this a human being who is suddenly collapsed in front of you. So after he is collapsed, immediately you do 5 steps to save his life. Shall we see how it is going to be? First, you are shifting the victim to a safer place. Then check for response. Are you okay? Are you okay? There is no response. Before that, call for help. So what is our emergency number? 4020 4020. Add a code 044 4020 4020. So after calling for help, next immediately check a pulse called carotid pulse. Where is your carotid pulse? You have Adam's apple, and beneath and to the side of the Adam's apple, one finger depth, you have a strong pulse called a carotid pulse. That is the most strongest pulse in the body by which we test the patient is alive or not. Once you check for the carotid pulse is present, that means the patient is alive. If the patient is alive, do not attempt CPR. If there is no carotid pulse, that means the patient has no heartbeat. So immediately we have to start a step called CPR. What is CPR? It's cardiopulmonary resuscitation. So how do you give CPR? The 5 steps to give CPR are: first, extend your right hand, then extend your left hand, and then clench your fist. Clench your fist, and the power should come from the base of your hand. So how do you give CPR? This is your body. Between the two nipples is the hardest part of the chest called sternum. So once you fix the sternum, then immediately do your 5 steps and place your hand over the sternum and start 1, 2, 3. So like this we can start. You need to give 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 28, 29, 30. 30 compressions should be given with 2 rescue breaths. How do you give rescue breaths? You head tilt and chin lift. You tilt the head and give a chin lift, and so that the airway is open, and you give mouth to mouth respirations with a pinched nose. So this is how you give rescue breaths. So once again I repeat. First, when you see someone unresponsive, shift the patient to a safer place. Then call for help immediately. If you are a single rescuer, you have to call the ambulance and then do the procedure. If there are 2 rescuers, myself and Dr. Kala are going on the road, I'll ask Dr. Kala, please call the ambulance. So our ambulance number is 4020 4020, and then we start with checking the carotid pulse. No carotid pulse, start CPR. How do you give CPR? Right hand, left hand, interlock. Then the power should be passed on the sternum, and 1, 2. And while giving CPR, the power should be from the hip, and there should be no folding at the level of the elbow. So the power is CPR. So you have to give CPR from the level of the elbow so that the power is not. You have to push hard and push fast. You have to, the depth of the CPR or the depth of the compression should be deep enough for the heart to start beating. So after 2 minutes, till qualified help arrives, you should continue the CPR.